Hey, hello everybody. Ashley here again for part 2 of the anatomy study guide on respiration. So we are going to start here with the second section, which picks up with some of the major cavities. So the first major cavity we're going to talk about is the oral cavity. So it includes many different structures that we've talked about. Most of the forward portions of the mouth, the lips, the soft and the hard palate, the space behind the wisdom teeth, the front 2/3 of the tongue. I mean, a really, really long list of things in the oral cavity. So why do we care about the oral cavity? We care about it because that's, of course, going to be one of the major ways that we're going to get air into the respiratory system. So the oral cavity is defined as the secondary source. You probably can guess what the primary external opening is to the respiratory system. It is the nasal cavity. So here is our nasal cavity. And again, this is where the majority of air is going to enter into the respiratory system. We know that there's special membranes and linings, increased surface area, lots of structures that make it ideal for taking in as much air as possible. So after air enters into our system, whether we're coming in from the oral cavity or the nasal cavity, we have a couple of major parts we want to look at in terms of where it's going to go. Let's see if I can move this a little bit. Sorry, I can't make it any brighter right now. So the region right behind that nasal cavity is going to be the nasopharynx, and that's going to be right back here. So just this little tiny region where my thumb is, between here, the nasal cavity and the back of the soft palate. The next region down from there is going to be the oropharynx, and the oropharynx is going to be from the soft palate, and that's going to continue on down here to where the hyoid bone would be, shown with number 1. So if you could kind of bring that over and stretch it back, that would be the oropharynx region, which we can just see the top part of it in our video. Below that, then, we would have one more region that we care about, which is the laryngopharynx. So the laryngopharynx is going to pick up with where the hyoid is with 1, and it's going to continue over the course of the larynx, and it's going to end here then once we get into the trachea, which is going to be right in here. If we pop this off, stay lung, stay. We can see the trachea right there. So again, the laryngopharynx is going to span that distance, that tube down in the back then. So again, that's going to be our path of air as it flows through. The next term on your study guide is the nasal conchae. So the nasal conchae are right up in here. There's 3 of them, and how nice, they're numbered here 1, 2, and 3. So 1, 2, and 3 could be better worded here for superior, middle, and inferior. And you can see here that these are dramatically increasing the surface area inside of the nasal cavity, which is going to be important. Okay, backing her up. So the next aspect we're going to look at are the noris, or the nostril. Not too shocking. We're going to look up Charlie's nose. Hey Charlie, how's it going? Here's our nostril. And of course, this is going to be the major way that we're going to get air into that nasal cavity. Not too surprising there. Okay, the next one is going to be the posterior nasal aperture. Not really clear on this particular model. Where it would be all the way back here. There's kind of a set of openings. So way back here would be the posterior nasal concha. Sorry, aperture. Okay. Next on our list then for this part 2 of our little study guide is the hard and soft palate. So the hard palate is going to be this bony region right here in the front. And the soft palate, then, you can see how it transitions away from that bony looking structure. That is the soft palate all the way in the back. The soft palate has a large number of functions in that respiratory system. It's going to have to actually move, or a better way to put that would be that it's going to actually have to be lowered when you are doing nasal breathing. So that soft palate has to be able to move. You also want to keep in mind that the soft palate is also going to be the reason why you can do things like breathe and eat at the same time. So it's a really important structure. The last part on here for this part of the study guide is the nasal septum. This person, if we give Charlie here, we get a profile. We see Charlie obviously does not have a deviated septum. That thing is straight. But the septum, it would be following right along through here, kind of what's shown where the blue would be. But we're not getting a clear look at that. We know that, of course, it would separate that nasal cavity into those 2 sides. So you kind of think about this like a 2-lane highway where you're getting more traffic flow because you have 2 separate lanes. And that's kind of what's happening for the respiratory system as well. Okay, that's the end of part 2, and I will pick back up with part 3.